Good afternoon, everyone, and welcome to today's update on COVID-19 in Alberta. With us, as always, is Dr. Deena Hinshaw, Chief Medical Officer of Health for the province. Dr. Hinshaw will provide a brief update, and then we will open the floor to questions.
Thank you, Tom, and good afternoon, everyone. I'm sorry to let you know that we were not able to have our sign language interpreters with us today. They will be back for future updates, as we know that they provide an important service that many people rely on. Over the last 24 hours, we have identified 402 new cases of COVID-19 and completed about 10,400 tests. Our positivity rate currently stands at about 3.9%. There are currently active alerts or outbreaks in 227 schools, or about 9.3% of the schools in the province. Currently, these schools have a combined total of 872 cases since January 11th. There are currently 251 people in hospital with COVID-19, including 48 in the ICU. Sadly, I must announce that 12 new deaths were reported to Alberta Health in the last 24 hours. My condolences go to those mourning the loss of a loved one, and to anyone who has lost a loved one from any cause. Please know you are not alone, and there is help to support you through this difficult time. Today, I would also like to update you on the first continuing care outbreak in Alberta containing variant cases. This outbreak was identified late on Friday at Churchill Manor in Edmonton with a single case. Since then, 27 staff and residents have tested positive. This includes 19 cases which have been confirmed as positive for the variant. Local public health teams and the operator are taking this outbreak extremely seriously and working closely together to limit spread and protect everyone involved. Last week, before this outbreak started, we implemented mandatory new protocols that are being followed. These created new, stronger measures for when a variant case is identified in any supportive living, long-term care, or hospice site. A combination of enhanced lab testing and rapid screening is being used to add to infection control protocols that are in place. Staff working at an outbreak site must not work at any other workplace for the duration of the outbreak. And anyone entering the facility will be required to wear a mask and eye protection continuously. I know that any outbreak is concerning, and AHS and the operator are working hard to prevent further spread and protect the health of everyone involved. Today, I'd like to update Albertans on a change to our vaccine program. As you know, Health Canada approved the AstraZeneca vaccine for use in Canada last week, which means we now have 3 safe, effective vaccines to help us in our fight against COVID-19. What's clear is that all 3 of these vaccines reduce the risk of getting COVID-19 and prevent serious outcomes, including hospitalization and death. We are still working to confirm exactly how many doses we will receive and when they will arrive. We hope to update you soon on how these vaccines will be distributed here in Alberta. Today, I am also announcing that Alberta is joining other provinces in adopting the National Advisory Committee on Immunization recommendation to extend the period between the first and second doses of COVID-19 vaccine, with a goal of providing first doses to all Albertans as soon as possible. We have now administered approximately 255,280 doses of vaccine in the province. More than 89,000 Albertans are now fully immunized with 2 doses. In the last week alone, we have administered almost 20,000 doses of vaccine. This is great news for our most vulnerable Albertans and those who care for them. In order to provide this protection opportunity to as many Albertans as possible, as quickly as possible, starting March 10th, anyone who books a first dose of vaccine will have their second dose timeline extended to up to 4 months. For those who already have a second dose appointment booked, it will go ahead as scheduled. And anyone who books their appointment before March 10th will still be able to book a second appointment within their 42-day window. From March 10th going forward, people who book vaccinations will only be able to book their first appointment, and they will then receive a reminder at a later date to book a second dose. The evidence on COVID-19 is constantly evolving, and it is critical that we use the most up-to-date information as we refine our approach. We've seen research from other jurisdictions that indicate one dose of the Moderna or Pfizer vaccine offers a huge boost in immunity, with Canadian data indicating around 80% protection against infection after the first dose. Data from the UK just released this week show 70% effectiveness from a single dose of Pfizer that stayed at a stable level over several months. This change will significantly increase how quickly we can offer Albertans the protection of their first dose. The more people that we can offer this protection to in the coming weeks and months, the more effective we will be at stopping spread. At the same time, second doses are still important, and we are recommending that every Albertan receive one within the 16-week window in order to provide long-lasting protection. This change is about providing the most benefit to the most people based on evidence that we have seen from around the world. We will continue to use the best available evidence to adjust our vaccination plan to protect Albertans, reflecting the real-time research being done. Of course, our rollout plan is dependent upon the supply of vaccine arriving in Canada and Alberta, and we will make any necessary adjustments as more information is available on vaccine shipments. Finally, I would like to remind anyone who is booking an immunization to please only book one appointment, either with AHS or with a participating pharmacy. Each time that you book an appointment for the vaccine, pharmacies or AHS are reserving a dose for you and saving a spot that otherwise could go to others. If you are booking and cancelling multiple appointments at various locations, you are putting another Albertan's dose at risk or delaying other people the chance to be immunized. If you are eligible and still haven't booked your appointment, there is time. There are still spaces available for Albertans 75 years of age and older to book their first doses, especially at participating pharmacies. If you were born in 1946 or before and live in or near Edmonton, Red Deer, or Calgary, please don't hesitate to contact the participating pharmacy that is closest to you to book an appointment. You can find a list of participating pharmacies on the Alberta Blue Cross website. AHS also has vaccine appointments available for this age group across the province, and you can go online or call 811 to book your shot. We can all take heart that by getting more first doses to Albertans more quickly, the change I am announcing today brings the light at the end of the tunnel nearer. We are making progress, but we must all keep following the health measures in place for a little while longer. By continuing to make decisions that keep our communities safe, and by continuing to go that extra mile, we will be able to keep ourselves and each other safe until it's our turn to roll up our sleeve and get vaccinated. Thank you, and I'm happy to take questions.
All right, we'll go to the phone now. Media will be allowed one question and a follow-up question as well. Operator, could you put through the first caller, please?
Thank you. The first question is from Kevin Nimick, CTV. Please go ahead.
Hi, Dr. Hinshaw. You mentioned the AstraZeneca vaccine today. I was a little unclear. Have shipments actually arrived in Alberta at this point?
No, we have not yet received our AstraZeneca vaccine.
Okay, so when are you expecting it? And also I wanted to add in, you just said you're requesting people book one vaccination appointment. Have Albertans been booking multiple appointments? And because of this, how many appointment slots have been wasted as a result?
We anticipate that we will be receiving AstraZeneca next week, but we don't yet know the exact date. So we will again have more information available as soon as we can to provide to Albertans. With respect to the question about multiple appointments being booked, I don't have the precise number, but what's been reported is that as people are seeking to find an opportunity to be vaccinated at a time and location that's most convenient, they do sometimes book in one location and book in another location. And ideally, if that does happen, we would want people to cancel that first booking as soon as possible. But what I would ask is that if people are considering their options, that they look at the options available to them and only book once, because, of course, even if people are canceling their previous appointment, constant churn can unfortunately cause some appointments to go unfilled. So we do ask that people only book one appointment and then honor that appointment as much as possible.
Operator, can you put through the next question, please?
Thank you, Jeff Slack, 660 News.
Hi there, Dr. Hinshaw. Thanks for taking my question. This is also about the AstraZeneca doses. These are supposed to expire early April, and we still don't really have a plan yet on who's going to receive these doses. And we know from rolling out the other vaccines that it'll take time to get these to their intended locations and for people to register to get their shots. Are we anticipating that there will be wastage from this shipment, given the tight timeline and the process that goes into getting this distributed?
It's important to remember that what we've been told in Alberta is that this first shipment is relatively small, with just 500,000 doses available across the country. What we understand is that 300,000 of the 500,000 doses have an expiry date of April 2nd, which would give us 3 weeks to use up whatever portion of the vaccine we receive that does have that April 2nd expiry date. And again, it's important to remember that that total volume of doses that Alberta receives will likely be quite small in relation to the larger shipments that we're currently receiving of Pfizer and Moderna. And so we will be, as soon as we have the details, letting Albertans know about which groups will be eligible to receive the AstraZeneca vaccine and how and when to make appointments. And then, of course, wanting to make sure that Albertans do book those appointments as quickly as possible so that we are able to utilize that vaccine within that 3-week window. And again, there is about 2/5 of that vaccine coming into the country that does have a longer expiry date. So it's not all the vaccine that we would anticipate needing to use by April 2nd.
Jeff, is there a follow-up?
Yes. I was just wondering more about the Churchill Manor outbreak. With 19 people testing positive for variant cases, how concerning is this that this has made it into a place like this? Is it possible that we could see more of this, given that we have said before that there is community spread of these variant cases?
This is a reminder that, of course, we are not out of the woods yet with respect to COVID-19 and the rapid spread that is possible with the variant. Of course, it's very concerning to see an outbreak where we go from 1 case to 27 within a matter of days. And it's a reminder that all of us need to be taking the precautionary measures seriously every single day, because the more that the variant and the more that the currently dominant strain spread in the community, the more likely it is that we could have reintroductions into these locations that are vulnerable, where there is that potential for rapid spread. We have been working, Alberta Health Services has been working over the past several weeks to offer immunization to all supportive living facilities where seniors live. And so we will in the coming weeks be able to ensure that these residents have that same level of protection, but it does take time. And so again, this is just a reminder that the serious consequences of COVID are not behind us, and we all must contribute to keeping our communities safe.
Operator, could you put through the next caller, please?
James Keller, Globe and Mail.
Hi, Dr. Hinshaw. Do you have an estimate? I know that a lot of this will depend on the speed of deliveries and all of that, but kind of the best case scenario or the most realistic case scenario of when you might be able to give the first dose to everyone in Alberta who wants one. I know in BC we've heard, they're aiming for July. So what do we have in mind for Alberta?
I think when we've spoken about this across the country, nationally, what we've heard is that sort of early summer timeline. We anticipate we'll have more information to share with Albertans soon when we've done the detailed calculations, but I think that it would be relatively similar to what you're hearing from BC.
Is there a follow-up, James?
And then, sure, and with this 4-month timeline, what do you think about that? Because the NACI guidelines acknowledge that there really isn't any evidence to support 4 months, and they're working with 2 months of data in the real world. So what do you think about that timeline, which is longer than I think people had been talking about before this week?
It's really important in a pandemic like the one we're experiencing that we use all available data, all available evidence. We currently have good evidence from, again, our own national experience, looking at data from BC, looking at data from Quebec, as well as data from the UK that shows that level of protection does stay stable over several months. And so the likelihood that we would see a steep decline following that, when we look at analogous evidence from other vaccine trials, it seems unlikely that we would see a very precipitous and sudden drop from, say, 2 to 3 months or 3 to 4. We will, of course, keep monitoring the evidence, but it's really important to remember that vaccines do two things. Vaccines protect the person who gets them, and vaccines protect those around them. And I think that it's really important to remember that if we can give that 70 to 80% protection to as many Albertans as possible, as quickly as possible, that provides us with the greatest benefit overall. And so, again, we will continue to watch the evidence, but both combining the current real-world evidence that we've seen in multiple jurisdictions with what we know about other vaccines, I think it's very reasonable to be confident that that level of protection would last for that time period, and that second dose would be able to provide the long-lasting protection that we want to see against COVID.
All right, we've got time for 3 more callers. Operator, could you put through the next one, please?
Julia Wong, Global News.
Hi, Dr. Hinshaw. With this change now to the timing between doses, how quickly will the province be able to move into other phases of the rollout plan?
We're working through right now the anticipated amounts that we expect to see, as well as the anticipated populations within each of those different sub-phases of phase 2 and then moving into phase 3. But as I mentioned earlier, nationally, the expectation is that we believe we would have enough vaccine across the country. So the same would be true in Alberta to be able to offer those first doses by early summer. And we expect to have more details about each of those specific subgroups in the days to come.
And as a follow-up, what happened at Churchill Manor to cause this explosion of cases? Had staff and residents at this site been vaccinated?
I don't have the details on what the likely location or activities that facilitated transmission were. What I know is that this particular site did receive their vaccinations as they were scheduled to do so on Monday of this week as a part of that rollout to supportive living facilities. And so that, of course, would not protect individuals who've already been exposed, but it will help those at that site to now be building their immunity, and those who haven't yet been exposed would be expected to have some protection against infection and severe outcomes within the next couple of weeks.
Operator, can you put through our second last caller, please?
David Staples, Edmonton Journal.
Hi, Dr. Hinshaw. So we were expecting to have 675,000 doses from the federal government by March 30th. And by March 1st, we were expecting to have 400,000 doses. I understand that we have about 275,000 doses. So it's a bit to make up between now and the end of March. Are we going to get that many doses by the end of March?
I'd have to take that. Sorry?
The 675,000 that we were expecting.
So I would have to take that away and get back to you with specific numbers. I believe we have now received confirmed allocations for the remainder of March from Pfizer. I'm not certain if we have received those from Moderna yet or not. So we can take that away and get back to you with respect to what we anticipate we will receive and whether or not there's any difference between what we originally anticipated and what has now been confirmed. So we'll take that away and get back to you.
Follow-up,
Thanks. And for my follow-up, I just want to make sure that I understand this latest. So with this policy of giving just the one vaccine dose, what you're thinking now is that any Albertan who wants to have that first vaccination, they're going to be able to get it likely sometime in June. Is that correct?
What we anticipate, again, is that if vaccine supply holds, and again, we are hoping to be able to provide a more precise estimate within the coming days, but if our vaccine supply holds, we anticipate that all Albertans age 18 and over, again, the vaccine, not all vaccines are licensed for use in under 18. So all Albertans 18 and older, we anticipate they would have the chance to receive vaccine by early summer.
Operator, could you put through our final question, please? Final caller, sorry.
Thank you. Yes, Tricia Kindleman, CBC Edmonton.
Hi, thank you. Yes, Dr. Hinshaw, just wondering if you might be able to give us a bit more information on the ongoing situation in northern Alberta, where there's been a high number of active case counts in some of the regions. I know up there a lot of people are forced to travel for medical appointments and a variety of other needs, so wondering if you can talk about sort of how that may have played into the situation.
You know, I think what we're seeing in northern Alberta is a combination of several factors. We know that in different places in northern Alberta, there are specific outbreaks. So we have seen outbreaks in some smaller communities, some First Nations communities. We've seen some outbreaks in particular business locations or shelter situations in Grand Prairie. We've seen a number of different types of locations where that spread has occurred from one to many relatively quickly. And so I don't think there's any single factor that's contributing to that high level of active cases in the North Zone right now. But I do think it comes back to the need to follow those precautions every day in every setting, because sometimes what we see is in communities where they haven't had a lot of COVID-19 or they don't currently have a lot of known COVID-19, people may feel that it's not a risk in that community. And as you say, well, I'm not able to tell you specifically whether or not or how much that travel has contributed, because communities are so interlinked and people travel from smaller communities to larger ones for services. It can happen very quickly when a case is introduced that spread can happen within several weeks if people are not following the COVID-19 protocols. And so, again, it's really important as we work to contain these specific outbreaks, we also need to get that message out that everyone across the entire province needs to be mindful that COVID-19 is still with us and the variant is growing, and we do need to follow those protocols on a regular basis every day.
And are you able to talk about the use of rapid testing in the area as well?
I don't have details on zone-by-zone breakdown of rapid testing, but I know that we have been working with stakeholders across the province to offer rapid testing kits for use in various situations. So that's maybe something that we can provide a more detailed update offline with respect to where we've sent the rapid testing kits for use in specific situations. I want to remind Albertans that rapid testing is a useful tool within a defined population as something that happens on an ongoing basis over time as a way to screen out early potential positives or infectious people. But a single negative rapid test is not a green light go ahead to do a risky activity. And so we are making sure that as we're rolling out the rapid tests, we're providing that information and the framework within which to use them.
Thank you all for joining us. Dr. Hinshaw will provide another update tomorrow afternoon. Have a safe night.